morning, guys. As a part of crown results and crown transplant, we already made enough videos, but such video again we wanted to show you. Usually, most of the people has the misconception that crown results will not occur well. So most of the patient even gave me feedback from different clinics, and on a general note also they told me it seems crown results doesn't help much. So that's not true. And there are a few points to be noted while thinking about the crown. That's most important. So if they can plan that way, crown results are not that difficult to achieve. That kind of details we're going to get into that video today. Crown results are very tricky and difficult because of many reasons. First reason would be usually the frontal hair. When you talk about the angulations of the frontal hair and crown hair, usually frontal hair falls such a way that light will not fall on the skin directly. Whereas when come to the crown, light will fall directly on the crown. The angulations also in a different circular fashion. That's the reason more light is going to fall on the crown area, and it reflects. That's the reason usually crown, when you do the implantation, transplantation especially, the transplantation technique usually camouflaging the growth. So while when we talk about the camouflage, we don't implant 100% density. We implant certain amount of density where it looks like, mimics like full density. When it comes to that trick, when implanting in the crown, if you implant straight manner, that you don't achieve the better camouflage. That's the reason crown always, even if you do transplantations, a scalp will be still seen. That's the one prime reason why the crown results are not that greatly successful. Number two is most of the clinics or doctors, when they implant crown, they do straight implantation, just like a frontal implantation. And that is the another reason you don't get a better camouflage. So crown results, crown implantation does not go straight angulations. It has its own unique kind of circular pattern. There is a swirls available. Depending on the naturalness of the swirl, we need to follow. Without following all these steps, just like implanting, just like a frontal area, one angulation, frontal angulation doesn't make good results. And this is the second reason. The third reason is very much important to understand. Most of the crown baldness, kindly remember, it is also associated with frontal baldness or mid-scalp baldness. There is very rare cases you got only crown baldness. So that means crown baldness is always a combination of frontal baldness as well as crown, or mid-scalp baldness as well as crown. So this is a sharing area. That's the reason when you target about the someone has a crown baldness as well the frontal area, most of the doctors, even most of the patients also would want to get hair in the frontal hairline first. That's the reason when you harvest the grafts, 80% of the grafts they are going to implant in the front. Only 20% they wanted to concentrate on the crown area, which is not enough. So that is the third reason why always crown doesn't appear to be with good results. Well, there are a few things to be before going to the plan the crown transplantation. As a patient and as a doctor also, we need to remember a few important points to get best results. When we consider crown transplantation, we need to see the extent of baldness also, not only crown. Is there any combination of crown frontal area and crown mid-scalp area? We need to understand. So here, when we plan that way, it's better to always plan crown transplant in a different session. In the sense, front one session and crown another session. Usually crown front and mid scalp can be done in one session. Maybe crown has to be done in second session. That's the good idea, number one point. Number two is, kindly remember, this crown always needs second session. Because of the we are not going to achieve better camouflage because of the natural swirl angulations. We may need at times, because of the size of the scalp also demands more number of the grafts. You cannot implant in single session. Probably you would need a second session. This is the second reason why crown results are not going to be great with one session. So if you can consider these two reasons and plan the transplantation, definitely one can achieve the better results. Well, today patient is a kind of a crown baldness extending to mid scalp, not to the front. So here we did one session, but it may not be possible in all the patients that way. So there is a crown baldness as well as the burrowing frontal baldness is happening in this patient. With one session, we planned transplantation with a little overcorrection to the front. That's what we did in this patient. Kindly watch the results. till the end. As we observed, this patient had a very good donor, and as we already discussed, is crown sharing with the mid-scalp baldness. That means we can say a smaller area. When crown is sharing with the front and mid-scalp, it will be bigger area. So it's because crown sharing with mid-scalp area baldness, and it's kind of one session we achieved a fantastic density. You can see even front, top view, and back view. Well, if he lose more hair in future, probably he would need the second session also. Conclusion of the crown transplant is number one, try to understand what kind of baldness you are right now into, and number two, kindly check your scalp dimensions and measurements with your doctor, because that plays an important role. And third one is even skin and hair color contrast also makes the difference, and how many grafts that are available, how many you are planning for the crown is most important. If you want to give more importance to front mid scalp crown in one session, I don't think no transplant can get you better hair, because transplant itself is a camouflaging technique. It's not a replacement for the lost hair. It is that we are going to do less grafts and trying to get you better camouflage. So that's the reason you may need a second session, even third session also for crown, mid scalp, and frontal area. That part you need to discuss with your doctor. And a simple sentence, like simple line for the crown is, sometimes it may not happen with one session. That's the conclusion of the crown transplants, and it's very difficult to get it done with amateur doctors or technicians, because you won't get any results with them. You need an expert who can understand your scalp natural angulations and availability of donor, and how better is going to plan your session, how many sessions. Definitely that makes the valid point when you are looking for the crown results. That's a thing is, always you would need a best expertise guy, expert surgeon to do your crown transplant. That's what I wanted to recommend you guys.